Our service users will be interacting with more than just one agency, so they might be seeing Careline for one aspect of their care, but then they might be communicating with doctors, surgeries, community agents, and then voluntary sector. And the biggest issue for us is how do we brief the wider community that's also involved with that service user exactly what has gone on.
So, for instance, you might have a service user who's got a social worker involved who are concerned that person can't stay at home and live independently, and they might be working to get them extra care or to move them somewhere else. And that's not always easy for a social worker to prove that person needs that extra support. So if they were aware that actually that person's pressed their pendant and called for help 5 or 10 times every day, we are going out to that service user 4 to 5 times a day, the social worker would be unaware of that information because we don't share the data with them. Now, we might be in a position where the doctor has recently put a service user who's got quite severe dementia onto medications such as blood thinners. If we're unaware of that, a carer could be going in and giving the service user their medication, and we get called because the service user has fallen. Now, if a service user falls and they are on blood thinners, that is an increased risk of an internal bleed. So it's really important that we know that information. We can pass that information on to the ambulance service if necessary, but just having all of that information in one place would help everybody because everybody would know exactly what's going on with that service user and mitigate any risks.